So there's a variety of paths to diagnosis. Many patients have been on what we call a diagnostic odyssey, which means they go from doctor to doctor and no one knows quite what they have. And part of that is that the symptoms are so variable, and they kind of cross multiple domains, where you may have gait problems and ataxia, but you may also have cognitive problems. And so they may not fit neatly into one kind of workup or another. And so they're not identified. And this is a lysosomal storage disease, but typical lysosomal enzyme panels don't identify it. So sometimes the patient will be tested for lysosomal diseases, but the test will be negative, because you have to be testing specifically for NPC to find it. And so they may see multiple doctors and have many tests before the abnormality is identified. Now, I will say, I think the diagnostic odyssey has been decreased a little bit in recent years, because there's more, if you have a complicated situation. I mean, like in the past, to diagnose NPC, you had to know you were trying to diagnose NPC. You were ruling out NPC. Now you can say, okay, this patient has a lot of weird neurological symptoms and I don't know what they have, so I'm going to send exome sequencing. And so you don't actually have to recognize you're looking for NPC to be able to diagnose it at this point. And that's, where they sequence all the protein coding parts of all the genes. Another way that diagnosis is sometimes made is that the patients that have a big liver and spleen, sometimes that raises concern about a lysosomal storage disease. And if they have that coupled with neurological symptoms, then they'll tend to start getting diagnosed because of having several different symptoms in several different organs where there aren't as many diseases that it could be. But some of the kids who've developed the liver problems early in life, the NPC is now on the neonatal cholestasis panel, which is a panel for liver disease early in life. And so the gene is on that panel. And so sometimes the patients will be diagnosed before they have any neurological symptoms, just because somebody did a gene panel to figure out why they have the liver disease. So these are all routes to diagnosis. I think we'd all like to see early diagnosis, because we hope that there are going to be treatments approved for NPC soon. And in fact, there is one treatment that is approved in other countries, but not in the USA, which is miglustatin. And I think we all believe that early treatment is important, and that it's better to treat when you're asymptomatic or very early symptomatic than to treat later. And so we'd like to see the diagnostic odyssey shortened.